So Joe, you are now almost a 10-year heart transplant survivor, and I think this is really impressive. And do you have any questions?
Well, yes, I do. But before I ask my questions, whenever you speak about the transplant, I have a special thought to my team, to the transplantees, to the recipients, to the patients that are waiting for an organ, to the doctors, the nurses, and a lot of respect to the donors and their family. They are our angels, and if it wasn't for them, we wouldn't be alive today, and we wouldn't be having this interview. And thank you for that, and all my respect and sympathy. Now, that being said, I have a very interesting question, actually, that a lot of my fellow transplantees experience. After my transplant, there's a lot of things in my habits that changed. I was a hunter. I turned vegan. I started having lemons after my surgery cravings. I had a craving for a cigar, which I don't really like cigars. I didn't like cigars. A lot of things that in my personality changed. Now I'm wondering, does this have to do with the cellular memory that we've been reading about, or can it be the trauma, or can you shed some light on this?
Yeah, absolutely, Joe. This is a very interesting topic, actually, and this has been a great topic of discussion and debate, especially in contemporary medicine and in different journals. So I am a neuroscientist. I'm a neurosurgeon. So I look at this from a neuroscientist perspective, and there are certain things that I don't quite understand, and reading up on it sort of opens up a lot of questions that arise today. So traditionally we thought about memory as being something that is primarily contained within the brain, and also there's another level of memory that's within your immune system, basically. Remembering certain diseases and pathogens, which is why vaccination works. You expose your body to a certain disease in a small amount, and then your body becomes immune to it. So when the disease comes back to try to infect your body has a memory of that disease.
Okay.
But as far as pragmatic memory, or day-to-day memory, if you will, like remembering certain things or objects or a certain smell or a certain food, traditionally we thought that this had its core or its center somewhere in the brain. We know that new memories are formed in a part of the brain called the hippocampus. So the hippocampus is, I show you the brain here, it's at the base of the brain, in what's called the temporal lobe. So this is the temporal lobe over here, and this is the hippocampus. And actually, a lot of memory research has taken place at the Montreal Neurologic Institute with Dr. Penfield, or Dr. Wilder Penfield, who is a very famous neurosurgeon from Montreal. But, so this is essentially where new memories form. As they get stored in your brain, they will get stored in different parts of your brain, and we don't have a very clear understanding on how they get stored or where they get stored once they are formed, basically. There are certain theories about that, things like what's called long-term potentiation and so forth, and I'm not going to go into a lot of details about these theories, but when it comes to transplant patients, more recently, over the 80s and 90s and today, we have noticed that a lot of these transplant recipients have developed memories or have thoughts that they never actually experienced previously in their lives. We talk about people remembering certain places they were, or certain smells, or having cravings for things that they've never craved before. And for example, I was reading about this not too long ago. There was a young girl that had received an organ from somebody who was murdered, and she actually was able to remember the shape and the face of the person who murdered
Wow.
the organ donor.
Wow.
Or another woman that had received a transplant and had never eaten chicken nuggets before, all of a sudden had craving for chicken nuggets, and they discovered chicken nuggets in the pockets of the organ donor.
Oh.
So there's a lot of these anecdotal stories and phenomena that are occurring everywhere in the world, and it is becoming more and more of an occurrence or an observation that it is no longer attributable to chance alone. There's a pretty high frequency of these events that are occurring, and if anything, it's underreported.
Yeah, because we don't know if it's the effect of the trauma, the drugs, and we don't have access to our donors, so we don't know the history of our donors. We don't know who they are, so we cannot know if the cigar craving came from the donor or from something else, or if my lemon craving came from him, if he was vegan or she was vegan or not. So
absolutely. So it brings up some other interesting questions, basically. And there's a lot of skeptics out there. You know, when you start talking about something like cellular memories or phenomenon that are associated with cellular memories, you're going to have people that are going to come out from sort of more traditional medicine thinking. They're going to tell you, well, no, that's impossible. This is because of the effect of this medication or this drug. This is a side effect of this treatment and so forth. And yes, you know, it is well known and well reported that things like taking steroids, like prednisone, for example, that you have to take for anti-rejection, has a very known and well-documented side effect, which is basically having a lot of food cravings and gaining weight because of these food cravings. And a lot of times it's going to be foods that aren't very good for you, that aren't very healthy for you. So this is something that is well known with this medication. And obviously other medications are going to have different types of side effects. However, even taking that into account, there's still some phenomenons, and more than just one or two stories here and there. It's something that we are seeing on a regular basis, phenomenons that are unexplained by our traditional way of structuring memory as something that's either contained in the brain or in our immune system. So researchers like Dr. Schwartz, for example, have looked at cellular memory more in a structural way, you know, trying to study sort of the energy that comes into these cells that are transferred in your body. And the volume of cells, does that change? You know, whether it's a larger organ with more cell volume versus a smaller organ. Things like the connections between these cells and your cells. You know, there are theories like the microtubular theory, which is the microtubules sort of at the microscopic level. There are changes that occur in your body that interconnects your body with the cells of this organ that essentially can change the entire functioning of your body or the entire structure. So it is a very interesting phenomena, and it is a question of great debate, basically.